So we do have something for everyone. So some on the call may have foot drop. So that's our Sabo step that allows you to lift your foot and clear it while walking. It's an out of shoe device, so it's not going to invade your shoe and cause pressure and pain, potential swelling buildup because of the tight straps, all the things that most folks complain about with those standard rigid AFOs. Of course, please keep in mind the Sabo step's not for everybody. If you have severe spasticity, or if your foot is really floppy and loose and flaccid, then you're going to be pretty unstable. Therefore, the AFO would be more appropriate. So anyone between having some movement or mild spasticity all the way to moderate spasticity and no movement, that's the appropriate category for people with Sabo step. But if you have severe spasticity and tightness or zero movement and completely flaccid, then the Sabo step would not be appropriate. Then we have the Sable Glove. The Sable Glove is a finger extensioner. It extends your hand, keeps your hand open. But that's designed for clients that have minimal spasticity. So if you have moderate to severe tightness or spasticity, the Sable Glove is not an appropriate product for you. In that case, you would need the Sabo Flex. And then, of course, we have the Sabo Stretch to help with contractures. So if you have a tight hand or any tone whatsoever, you should definitely be getting the Sabo Stretch bare minimum. And that's going to help stretch out your spasticity and keep your hand as loose as possible and prevent contractures. The Sabo Stim Micro, that is a conductive electrical stimulation glove. That device is not going to contract your muscles. It's not going to stimulate your muscles. That's a different product we have. This device is actually going to target your sensory receptors. So you may think you have perfect sensation, but chances are you don't if you have impaired function. And the Sabo Stim Micro, in addition to improving sensation, also helps with rewiring the brain and neuroplasticity. It also helps with reducing spasticity and improving what they call motor neuron recruitment. And of course, if you have what's called inattention or neglect or a hard time focusing on your involved side or sensory deficits, then this device is certainly very important in your regimen that you should be considering. So I like to make sure that clients at least have the last two products, the Sabo Stretch and the Sabo Stim Micro minimum, and then I'll explain other products that would round out that basic home program. This is our mobile arm support. So if you have shoulder weakness and you have a hard time lifting your arm, this mobile arm support will unweight your arm so you can do basic repetition and strengthening. I call it the arm treadmill, if you will, because it's going to work out your shoulder and your elbow. And that's for people who have a hard time lifting the arm. Bottom left, you'll see a little electrode that's on the arm. It's a wireless, wearable electrical stimulation device called the Sabo Stim 1. That's an e-stim device that's going to contract or open your hand. That's one that's going to strengthen your muscles. The one on the other side, the far right, bottom right, that's e-stim also. It's electrical stimulation also, but it's not going to cause your muscles to move because that stimulated the sensory receptors. The one on the far bottom left stimulates the motor nerve, which causes the muscle to contract. Okay. Now the Sabo Flex. This device is perfect for patients who don't qualify for the Sabo Glove, which is this one. So if you have more than mild tightness or spasticity, then this Sabo Glove is not appropriate for you, but you're definitely a great candidate for the Sabo Flex. Okay? It's built for spasticity. Then finally, the Sabo Mirror Box. I mentioned Mirror Box before. The affected limb is in that box. The reflection of the mirror is of the right unaffected side, but it looks like it's the left affected side. Tricks the brain. Brain thinks that the left hand's moving fine, and that helps with rewiring the brain. It's a phenomenal treatment approach and highly recommended.